When it comes to the new healthcare law, the question on most Americans' mind is, what about me? Today, we will be looking at some of the big questions on your mind. Avitas Group's Senior VP of Finance, Steve Bentley, will walk us through what the mandate means for you. What is the current status of Obamacare and its implementation?
All of the requirements and due dates in the Ppaca have not changed. The provisions which required new reporting from employers about healthcare plans that they sponsor for their employees have been delayed for 1 year and will be implemented for 2015. In addition, the penalties for employers not providing affordable health care for their employees and dependents have also been delayed until 2015.
What are the implications of those delays?
Employers who have existing health plans may continue operating them in 2014 just as they have before. The plans will not have to meet any affordability provisions. They will have to meet the other requirements of the law, including the essential health benefits, but most, if not all, plans have already been modified to do so. Employers who do not have a plan but would be required to provide one under the law may avoid doing so for 2014 only. Employers who do not have a plan and do not have to provide one under the law are unaffected by this delay. Other provisions of the law affect all employers, such as the employee notice due October 1st. They have not been delayed, and employers will need to comply with all of those provisions.
What is the individual mandate?
The individual mandate is a provision of the federal health law that requires you, your children, and anyone else that you claim as a dependent on your taxes to have health insurance in 2014, or you pay a penalty. That coverage can be supplied through your job, public programs such as Medicare or Medicaid, or an individual policy that you purchase. In Montana and in several other states, the Medicaid option for low-wage earners will not be available. The health law is setting up online health insurance marketplaces, also known as exchanges, to help you shop for plans.
Are there any exceptions to the mandate?
Yes, there are. The government has identified several exemptions. Individuals who cannot afford coverage because the cost of the premiums exceed 8% of their household income, or those whose household incomes are below the minimum filing requirements for filing a tax return, will all be exempt. People experiencing certain hardships, including those who would have been eligible for Medicaid under the health law's new rules, but whose states have chosen not to expand their programs, such as Montana, are also exempt. Other exempt groups include prisoners, Native Americans eligible for care through the Indian Health Care Service, immigrants who are in the country illegally, people whose religious objections to having insurance coverage exist, members of a health care sharing ministry, and individuals who experience a short coverage gap of less than 3 consecutive months. The Congressional Budget Office estimates that in 2016, after the major provisions of the health law are implemented, 24 million people will be exempted from the mandate's penalties.
Why is there a mandate anyway?
Well, the health law was designed to extend insurance to nearly all people, including those who have medical conditions that require expensive care and are often denied coverage today. But to pay for their care, insurance companies need to have a large enrollment of consumers, especially young and healthy people who use fewer services. The mandate was adopted to guarantee a broad base of participation. Some believe the mandate won't be effective because the penalties are set so much lower than the actual cost of coverage.
How do I satisfy the mandate?
Health coverage provided through a job-based plan, which would include COBRA if you are terminating from a job, or a retirement plan, policies that you buy for yourself or for your family, Medicare if you're eligible, including Medicare Advantage, Medicaid if it's available in your state, CHIP programs for young people, some Veterans Administration health programs, and TRICARE coverage, which is available for members of the military and their dependents, will all satisfy the mandate. If you are uninsured or thinking about switching plans, you can shop for coverage through the online marketplaces beginning October 1st. These marketplaces will operate in every state and in the District of Columbia and will alert people with lower incomes that they are eligible for Medicaid, again, if it's offered within their state. The marketplaces will also offer tax subsidies to help reduce the cost of premiums if your household income is less than 400% of the federal poverty level. Now, that amount comes to $45,960 for individuals and $94,200 for a family of 4 in 2013. Those amounts will be inflated each year for the cost of inflation. And cost-sharing subsidies That will also substantially reduce the deductibles, co-payments, co-insurance, and total out-of-pocket spending limits for people with incomes that are at 250% of the poverty level or less, which equates to $28,725 for an individual and $58,875 for a family of four in 2013. Although the law takes effect January 1st, the initial enrollment period actually continues through March 31st. Since people are exempt for a short coverage gap, less than 3 months, individuals that obtain coverage before the end of March will be exempt from the payment of the penalty for 2014.
How do I report my coverage or exemptions to the government?
You will not have to report coverage or exemptions until you file your 2014 income tax return, which won't be due until April 15, 2015. Insurance providers will also be required to help their clients report their health coverage. The Internal Revenue Service says it will put out details later about how the reporting will work. There'll probably be some new form we'll all have to fill out. If your income is so low that you don't have to file a tax return, then you're exempt from paying the penalty or filing any type of report.
What happens if I don't get coverage?
If you do not have the minimum level of coverage and do not qualify for one of the exemptions we talked about, then you're supposed to pay a penalty to the IRS at the end of the tax year. The penalty for the first year, 2014, is up to $95 per adult and $47.50 per child, or 1% of the family income, whichever is greater. So it's not just $95, it could be more if your income is larger. This fine, however, will increase over time, and in 2016, it will total $695 per adult and $347 per child, with a $2,085 maximum per family, or the greater of 2.5% of the family income. So if your family income is $50,000, then you may have a $7,500 penalty. The amount you owe will be prorated to reflect the number of months you were without coverage. And remember, if it's 3 months or less, then there's no penalty. The Congressional Budget Office estimates that 6 million people, or about 2% of the population, will choose to pay the penalty in 2016 instead of obtaining coverage.
How do I apply for an exemption?
If you are seeking an exemption for incarceration, membership in an Indian tribe, or health care sharing ministry, you can apply through the health insurance exchanges or make a claim when you file your taxes, according to a final rule issued by the U.S. Department of Health and Human Services. If you are claiming an economic hardship or a religious exemption, then you must get an exemption certificate from the online insurance exchange. If you are claiming that coverage is unaffordable, or you're in the United States without proper documentation, or you have a coverage gap of less than 3 months, you can make the claim when you file your 2014 taxes in 2015.
Where do I start?
Well, everybody will start at a website called healthcare.gov. Healthcare is one word. That's the federal government's portal for the health insurance marketplace, and it will help you find the exchange for your state. You will answer questions, plug in your state, and your exchange will tell you whether you can buy insurance this way and if subsidies or tax credits will be available. More complicated scenarios can be discussed with call center employees at the Federal Exchange at 800-318-2596.
What am I shopping for?
Exchanges will offer a selection of plans that are classified as bronze, silver, gold, and platinum, representing different levels of cost sharing between the insurance company and the consumer. Bronze plans will have the highest deductibles, the greatest amount of cost sharing, and platinum plans will have the lowest. All insurers participating in an exchange have to offer at least a silver and gold level plan, but most will also offer bronze level plans and some will offer platinum plans. It will vary from exchange to exchange. Mid-level silver plans will tend to have a deductible of somewhere around $2,000 a year before coverage kicks in.
What's my deadline?
State-by-state health insurance marketplaces or exchanges will begin enrolling customers October 1st. Coverage begins January 1st for anyone who signs up by December 15th. We recommend that if you're going to purchase coverage from an exchange, you should begin looking into your options soon after the October 1st enrollment kickoff so that you'll have up to 6 months to decide. There's time to go slow, absorb what you're learning and really understand it, and there will be a lot of assistance available if you're having problems with the information that you're getting.
What if I've been denied coverage before?
Worry not. Those whose health problems kept them from getting insurance in the past may benefit the most from this new law. Studies show that 1 in every 2 Americans has had or does have what could be characterized as a pre-existing condition, and they've been subject to not getting insurance in the past. If you have anything from arthritis to cancer or any one of a number of simple health problems, insurers can no longer deny you coverage.
Thank you, Steve. This has all been very helpful. Avitas Group is here to make the PPACA transition easier on you and your business. Visit us online at avitasgroup.com/Obamacare to read more on the Affordable Care Act, to download the exchange insurance application, and to see how we can assist you on the healthcare changes.